What is the best anesthesia for vasectomy reversal? Hi, I'm Dr. David Wilson with reversalclinic.com. We are the largest provider of vasectomy reversal in the United States because we are helping families grow. You may have wondered, given what you've heard on the internet, chat groups, forums, about what is the best anesthesia for your or your loved one's reversal. You may have heard some conflicting reports. Some say this anesthesia is best, others say this type of anesthesia will actually decrease results. And so you may be in a quandary, just what is the best in this case. On the other hand, you may not have thought of this at all, but now that it's been raised, you're wanting to hear what is the evidence. Well, the reason there's so many conflicting reports and statements on the internet is because very little of it is based upon science or actual experience. Here in this video, you may hear some things you won't hear anywhere else. We're going to give you the scientific evidence for results of vasectomy reversal based on different types of anesthetic. We'll also describe side effects and other criteria that should come into your decision about which is best for you. The scientific study done in this area is the Vasovasostomy Study Group trial. It's the largest, or rather most comprehensive, and the largest multi-center trial that's ever been done. It was published in 1991, but after all these years, it is still considered the landmark study in the literature. Dr. Arnold Belker and 4 other expert microsurgeons in 4 different centers around the country compiled their results and did a comprehensive study of many different factors regarding and surrounding vasectomy reversal. So it's an excellent source of science or truth in this area. The study was described as the best, most comprehensive trial 2 years ago in the Cornell Group's review of the surgical literature regarding vasectomy reversal. Still is the landmark, the benchmark, if you will, for the field. There were 1,100 first-time reversal patients in this wonderful trial that gives us this good information. And there were 2 main types of anesthesia. The first type is general anesthesia, and the second type was local anesthesia. Now, as you probably know, general anesthesia involves putting the patient to sleep using an IV and mask anesthesia, controlling the patient's airway and actually breathing for the patient, putting a breathing tube in so the patient is completely still and completely unaware of the surgery. In this study, 473 patients had that type of care who subsequently had test results. Of these 473, 402 actually had positive test results following their reversal procedure. So there were 85% of the general anesthesia patients in this study that actually had positive results. The average time from vasectomy was about 7 or 8 years, so as you could imagine, the patients who were just a year or 2 after vasectomy had much higher rates than 85%. The patients who were 15, 20 years out had lower rates. But overall, with general anesthesia, the 85% had return of sperm. In the same study, there were 515 patients who had local anesthesia. Local anesthesia is just placed with a small needle into the region in a local area in order to do the procedure without pain. Of these 515 patients, 441 had positive test results, or 86%. So in fact, the results were somewhat better with local anesthesia than with general. However, differences were not statistically significant. So the conclusion was that there is no difference in results for first-time reversal patients with different types of anesthesia. The truth is, anesthesia does not directly affect results of the procedure. Now, there are other things to consider besides simply the results or the success of the surgery. These things would include the side effects of the different anesthetics. The general anesthesia has known post-anesthesia nausea, vomiting in some patients. There's about an hour-long recovery to wake up and to come out of a drowsy or somnolent state. In local anesthesia, there is no drowsiness per se. There's no nausea, vomiting. Patients before general anesthesia are kept in PO or unable to eat. Patients before local anesthesia are able to eat. They can eat breakfast, lunch, whatever before the procedure time. There is a third type of anesthesia that was not performed routinely in the trial. That's called IV sedation. And the IV sedation again involves an intravenous cannula usually in the arm. And normally that isn't much pain before or after, but that is some discomfort compared to local anesthesia where there's no IV needed. Local anesthesia, there's typically a few seconds of pain or discomfort at the very beginning of the procedure to get the vas numb, but then there's no other sites of pain or discomfort after the procedure. In larger doses, it's been reported some tingling or other effects of the local anesthetic, but we've seen no harmful side effects of local anesthetics over the past 12 years. So a very safe, low side effect with the local anesthetic. Of course, the cost of the patients are much higher with the general anesthesia or IV sedation. It takes specialized personnel, specialized equipment and monitoring, and a specialized facility to have those types of anesthetic. The local anesthesia can be done safely and well in a simple clinic setting. So the reversal clinic is convinced that local anesthetic is in fact the best choice. Your own decision is going to be based upon your take on these different parameters, but we feel that local anesthesia is the standard of care for first-time vasectomy reversal patients. You may have heard the phrase, less is more. In this instance, we believe the less invasive, less costly anesthesia is better for our patients. Well, thanks again so much for watching. Please place comments or questions below. I'll try to make time to respond to those. And I'll see you on the next video.